Today I am going to explain you about the nerve supply to the heart. Okay, the heart is supplied by both sympathetic and parasympathetic nerves. Our body is made up of central nervous system, peripheral nervous system, and the central nervous system, peripheral system both contains sympathetic and parasympathetic nerves. So heart is supplied with both the sympathetic and parasympathetic nerves. Okay, the parasympathetic nerves are also called as the main nerve is vagus nerve. Okay, are distributed mainly to the SCA and AV nodes. What is SCA? It is sinoatrial node, and AV is atrioventricular nodes, which are located in the heart. To a lesser extent, to the muscle of the two atria, and very little directly to the ventricular muscle. So here what we have to understand is this parasympathetic nerves supplies mainly to the nodes of the heart. One is SCA node and AV node. To lesser extent to the muscle of two atria, and very little directly to the ventricular muscle. Okay. Conversely, the sympathetic nerves are distributed to all parts of the heart with a strong representation in the ventricular muscle as well as in all other areas. See here, sympathetic nerves are mostly supplied to the wall muscle of the heart, whereas this parasympathetic nerves supplies to the nodes of the heart. Okay, this is the difference you have to remember. So what is the coming to the parasympathetic stimulation. So what will happen if there is a parasympathetic stimulation, or it is also called vagal stimulation, because the parasympathetic system is controlled by the vagus nerve. Okay, so when there is any vagal stimulation, it slows the cardiac rhythm and conduction. Okay, stimulation of the parasympathetic nerves to the heart causes acetylcholine to be released at the vagal endings. So whenever this vagal nerve is stimulated, it releases a neurotransmitter called as acetylcholine at the vagal nerve endings. Okay, so what is the effect of this neurotransmitter? This neurotransmitter has two major effects on the heart. First, it decreases the rate of rhythm of the SI node, that is sinus node, and second, it decreases excitability of the AV junctional fibers between the atrial musculature and the AV node, thereby slowing transmission of cardiac impulse into the ventricles. So here, what are the two important things that this vagal stimulation of the heart doing is, first of all, it decreases the rate of rhythm of the SCA node. So the SCA node rhythm and rate is decreased, and secondly, it decreases the excitability of AV junctional fibers between atrioventricular junctional fibers. Where they are located? Between the atrial musculature and the AV node. See, from atrial musculature to the AV node, there are some fibers connected. Okay, to conduct the impulse from atrium to the AV node. From AV node, it is transmitted to the ventricles. So here what it is happen, these vagal stimulation causes decrease in excitability of AV junctional fibers between atrial musculature and AV node. So what will happen, the impulse which is generated from the atria are not carried to the ventricles because this vagal stimulation is causing decrease in excitability of AV junctional fibers. Okay, so thereby slowing the transmission of cardiac impulse to the ventricles. So final effect is what? There will be decrease in heart rate, or sometimes the heart will stop. Okay, that is the effect of parasympathetic nervous system. Okay. Now, here you have to know the concept of ventricular escape. See, sometimes what will happen, strong stimulation of vagi can completely stop the rhythmical excitation by the sinus node, or completely block transmission of cardiac impulse from the atria into the ventricles to the AV node. In either case, rhythmical excitatory signals are no longer transmitted to the ventricles. Okay, so if we stimulate the vagus nerve much more, what will happen? There will be completely, it will stop the rhythmical excitation of the SCA node. So you know that SCA node it itself automatically get excitable, and it will get depolarized, and will get hyperpolarized and get excitable. You know that thing, right? Okay. So this vagal stimulation will cause? It will completely stop the rhythmical excitation of SCA node, sinus node, or it can also block transmission of cardiac impulse from atria into the ventricles through AV node. Either of this it will do. Okay. So what will happen? In In either case, rhythmically excited signals are no longer transmitted to the ventricles. So what will happen? The ventricles will not either contract or relax. Okay, the ventricles may stop beating for 5 to 10, 20 seconds, but then some small area in the Purkinje fibers, usually in the ventricular septal portion of AV bundle, develops a rhythm of its own and causes ventricular contraction at the rate of 15 to 40 beats per minute. The phenomenon is called ventricular escape. So if the vagal stimulation, in what will happen, it will cause atria to stop and also try to stop the ventricles to contract and relax. But here we know there are some Purkinje fibers. This AV node is branched into Purkinje fibers to supply the either part of the ventricles. So what will happen? Small area in the Purkinje fibers. See, in small area in the Purkinje fibers, usually in the ventricular septal region, where these Purkinje fibers are present, they are present in the ventricular septal region on either side of the ventricular walls. Okay, but here the small area in Purkinje fibers, which are located in the septal portion of the AV bundle, which are located in the atrioventricular bundle, develops a rhythm. It develops its own rhythm of its own and causes the ventricular contraction at a rate of 15 to 40 beats per minute. Okay, so this phenomenon is called ventricular escape. So in vagal stimulation, what will happen? Though it will try to stop the ventricular from beating, but the rhythmic activity developed in the AV bundle will cause the ventricular to contract at the rate of 15 to 40 beats per minute. So here ventricular is escaping from the vagal stimulation. So this is called as ventricular escape. So how it is escaping? Because of self-excitability of AV bundles. Okay, some AV bundle leads to ventricular contraction at the rate of 15 to 40 beats per minute. Okay, so this process is called this phenomenon is called ventricular escape. Okay, so what is the mechanism of vagal effects? The acetylcholine released with the vagal windings greatly increase the permeability of fiber membranes to potassium ions, which allows rapid leakage of potassium out of the conductive fibers. So whenever there is a vagal effect is there, the acetylcholine released, what will happen to increase the permeability of the fiber membranes to potassium ions, which leads to rapid leakage of potassium out of the conductive fibers. Potassium will leave. Okay, this process causes increase in negativity inside the fibers, an effect called hyperrepolarization. Whenever the potassium is went outside, it leads to more negativity and it causes hyperrepolarization, which makes this excitable tissue much less excitable. In the sinus node, the rate of hyperrepolarization makes the resting membrane potential of a sinus nodal fibers more negative than usual, that is 65 to 75 millivolts rather than normal level of 50 to 60 volts. So what will happen here in the sinus node? The state of hyperrepolarization. What will happen due to hyperrepolarization? It makes the resting membrane potential of sinus fibers more negative. What will happen? It leads to more negative. Okay, normal resting membrane of the sinus node is minus 55 to minus 60, but once there is a vagal stimulation, what will happen? It will increases its resting membrane potential to more negativity of around minus 65 to minus 75. So here the self-excitability of SA node when the resting membrane potential of about minus 55 to minus 60 is lost. So whenever the self-excitability of SA node around minus 55 to minus 60 millivolts presence is lost, SA node cannot itself self-excite. So what will happen? There will be no further beats from the SA node or no impulse from the SA node. This is what they are telling. Here, due to vagal stimulation, what will happen? Potassium will leak away from the fibers. And this causes more negativity. This more negativity will cause hyperrepolarization. This due to this more hyperrepolarization of around minus 65 to minus 25, the self-excitability of SA node is lost. Okay, so there will be complete stop of SA node. Therefore, the initial rise of sinus nodal membrane potential caused by inward calcium and sodium leakage requires much longer to reach the threshold potential for excitation. Okay, this requirement greatly slows the rate of rhythmicity of the nodal fibers. So, if the vagal stimulation is strong enough, it is possible to stop the rhythmical self-excitation of this node entirely. Okay, in the AV node, a state of hyperrepolarization. Understand? That's what we're saying. If the vagal stimulation is much more, what will happen? Entirely it will stop the rhythmical self excitation of the node completely. That's what again is telling. And you see here, therefore, the initial rise of sinus nodal membrane potential caused by the inward calcium and sodium leakage requires much longer to reach the threshold potential for excitation. This requirement greatly slows the rate of rhythmicity of these nodal fibers. Understand? That's what. So once here potassium is leaked out, what will happen? There will be more of calcium and sodium inside. This sodium and calcium, which gives the positive power to the cell, will requires much more amount of this potassium. So there is no potassium here. Potassium is going out due to vagal stimulation. So this requirement greatly, this much more requirement, what will happen? Greatly slows the rate of rhythmicity of these nodal fibers. Okay. Finally, when the vagal stimulation is very strong, it will completely stop the SC node. Understand? So this is what the nerve supply of the heart of parasympathetic nervous system. In the coming video, I will explain you about the sympathetic nervous system. Okay. Thank you very much.